Hello and welcome. Today we're diving deep into sarcoidosis, a complex inflammatory disease that can affect various organs, including the nervous system. We'll explore its causes, how it impacts the body, its symptoms, diagnosis, treatment, and more. Join us as we unravel the mysteries of neurosarcoidosis. The exact cause of sarcoidosis remains a puzzle, but scientists believe it's triggered by a combination of genetic predisposition and environmental factors. Exposure to infectious agents like bacteria or viruses, or non-infectious substances such as dust or chemicals, may initiate an immune response in susceptible individuals. This immune response, instead of targeting the foreign invader, goes awry and causes the formation of granulomas, the hallmark of sarcoidosis. Sarcoidosis is characterized by the formation of granulomas, which are clumps of inflammatory cells. In neurosarcoidosis, these granulomas infiltrate the brain, spinal cord, cranial nerves, and peripheral nerves. These granulomas can disrupt normal nerve function by compressing or damaging nerve tissue, interfering with signal transmission, and causing inflammation. The specific neurological symptoms depend on the location and extent of granuloma formation. Sarcoidosis affects people worldwide, but it's more common in certain populations, including African Americans and people of Scandinavian descent. Women are slightly more likely to develop the disease than men. The incidence of sarcoidosis varies depending on geographic location, age, and ethnicity. Neurosarcoidosis occurs in a relatively small percentage of individuals diagnosed with systemic sarcoidosis, estimated to be around 5–15%. Neurosarcoidosis symptoms can vary widely depending on the location of granulomas within the nervous system. Common symptoms include cranial nerve palsies, particularly affecting the facial nerve and causing facial weakness. Other symptoms include headaches, seizures, cognitive dysfunction, vision changes, hearing loss, weakness or numbness in the limbs, and problems with balance and coordination. In some cases, neurosarcoidosis can mimic other neurological conditions, making diagnosis challenging. Diagnosing neurosarcoidosis requires a combination of clinical evaluation, imaging studies, and laboratory tests. Magnetic resonance imaging or MRI of the brain and spinal cord is crucial to identify granulomas or other abnormalities. Cerebrospinal fluid analysis, obtained through a lumbar puncture, can reveal elevated protein levels and inflammatory markers. Biopsy of affected tissue, such as a nerve or brain lesion, is often performed to confirm the diagnosis and rule out other conditions. Ruling out other conditions is crucial because neurosarcoidosis can mimic multiple sclerosis, Lyme disease, and lymphoma. Sarcoidosis is generally categorized as systemic when it affects multiple organs. While there aren't strict classifications for different types of neurosarcoidosis, the disease can be characterized based on the specific neurological structures involved. For example, cranial nerve involvement, meningeal involvement, or spinal cord involvement. Understanding the specific pattern of neurological involvement is important for tailoring treatment strategies. Treatment for neurosarcoidosis aims to reduce inflammation and prevent further damage to the nervous system. Corticosteroids, such as prednisone, are the mainstay of treatment and are used to suppress the immune system. Immunosuppressant medications, like methotrexate, azathioprine, or mycophenolate mofetil, may be used in conjunction with or as an alternative to corticosteroids, particularly for long-term management. In severe cases, biologic therapies, such as TNF inhibitors, may be considered. Physical therapy, occupational therapy, and symptomatic medications can help manage specific neurological symptoms. Currently, there are no known preventive measures for sarcoidosis. Since the exact cause is unknown, avoiding potential environmental triggers is difficult. However, maintaining a healthy lifestyle, avoiding smoking, and minimizing exposure to known lung irritants may be beneficial for overall health. The prognosis for neurosarcoidosis varies depending on the severity and extent of the disease, as well as the individual's response to treatment. Some individuals experience complete remission, while others have chronic or relapsing symptoms. Early diagnosis and prompt treatment are crucial to improve outcomes and minimize long-term neurological deficits. Research continues to focus on identifying the underlying cause of sarcoidosis and developing more targeted and effective therapies. Some recent studies are investigating the role of specific immune cells and inflammatory pathways in the development of neurosarcoidosis, which could lead to new treatment strategies. Thank you for joining us in this overview of neurosarcoidosis. We hope this information was helpful.